It is a great pleasure to welcome you all to the third annual Global Human Rights Symposium.
The Human Rights Fellowship emerges from a broader human rights initiative at Gallatin, attempting to link human rights practice with academic work in human rights.
Hi everyone, my name is Lindsay Jordahl and I spent the summer in Mumbai, India, working with an organization entitled Armaan and examining the right to maternal health care. Throughout college, I've been focused on the intersection between gender and health, and this project allowed me to put my academic knowledge to use and have a more applied, based understanding of the topics that I've been studying. So like I said, I traveled to Mumbai to better understand different methods of approaching the human right to maternal health care and to learn about the strategies that the organization I was working with is using to provide this care to women. Okay, so I worked with an organization called Armaan, which is an acronym for Advancing the Reduction of Morbidity and Mortality of Mothers, Children, and Neonates. So that's kind of a mouthful, and they shortened it to Armaan, which also means a wish in Hindi. So their mission is to reduce rates of maternal mortality and morbidity by providing education to women and the public on healthcare availability and health topics by using different types of technology, mostly cell phones, computers, tablets, different things like that. So they have 3 different projects that they focus on, and I only worked with 2, but I'll describe a little bit of all 3. The first one is called Vasuki Home-Based Care, and through this program they train health workers to provide care to women, mostly in rural villages right now. And while I didn't specifically work on this project, I did go to help and observe different field site trainings for these women, and that's where most of the pictures that I have in this presentation come from. But the 2 projects that I did work on, the first one was called M-Mitra Mobile Messaging. So this is a mobile messaging service which provides voice messaging and animation to pregnant women, and it's timed and targeted, and specifically for right now women living in rural areas, but they're expanding to urban poor areas really soon in the next 2 years or so, because they just received a very large grant to do so, which is exciting for them. And then the next project that I worked on is called Project Hero. And this is, Armaan is developing a mobile web app to provide information to the public on availability of hospital beds and blood in blood banks so that people can be better prepared in emergency situations, because not all hospitals have beds always available or blood always available in their blood bank. So if they have this information online, if an emergency happens, people can go on this system and check to make sure that the hospital that they're heading to will be able to help them. This system is interesting, but definitely flawed in some ways, because you have to be able to access it through a computer, or if you have a smartphone, you need to be able to use it through that. So a lot of what I did with these projects is create community outreach strategies, specifically to involve youth in programs. Armaan was really trying to create a youth movement because they hoped that the youth would help to kind of motivate the rest of the community. So I tried to brainstorm on different strategies to get youth in the city involved in these programs. Another thing that I did was development and grant work. I did a lot of research for their programs and then tried to create strategies for them to use this research to put it back into grants. And then the third thing that I did was I helped with hospital coordination. So for Project Hero, they need to coordinate with hospitals. Right now they have 11 hospitals signed on board to provide this information, and they're really trying to create these partnerships and make them really meaningful. So I helped as much as I could with that. So a little bit of background information for why these projects are important. In India right now, the maternal mortality ratio is about 235 deaths to 100,000 births. So that's pretty high, and for every death, there are 20 pregnancy-related complications. Most of these happen because of little health education and access to antenatal care, especially in rural areas and in urban poor areas. So the goal is to try to provide that education and care, and that's why I think that especially the messaging service is really interesting, because it provides education to pregnant women through voice messages and gives them a little bit more information of how to provide care for themselves. And another reason why, I forgot to include this, but why the technology portion, especially cell phones, is so interesting for India is because right now, India has almost 870 million cell phones in use out of a population of 1.2 billion. So that's a huge resource that they can use to tap into different systems that are a little bit lacking, like healthcare infrastructure, and try to fill in those gaps. So then a couple things that I was thinking about, like Martha said, a lot of the things that I came back with are more of questions rather than concrete set things that I've realized. So one thing that I was thinking about that was very unexpected for me is whether technology is a human right. So with something like cell phones, if you have so much potential for providing information to people, is that something that can be classified as a human right? And is that something that we want to say, especially as this technology is developing? If you can provide crucial health information to people, is that something that we want to label as a human right? And then another thing that I was thinking about is kind of the pros and cons of having nonprofits be such an outlet for providing rights to people. Something that I personally saw working at Armaan is that while they're a really wonderful organization with great intention, one thing that they had so much trouble with is funding and trying to staff their organization for all of their projects while also constantly relying on information coming in, on funding coming in through grants. And they were always kind of having to base what they were going to do next on where that money was coming from. And so that was something that I saw them struggle with as a staff because they were a little bit overworked because of that. And so I kind of wonder how we're going to think about these rights and providing these rights when it's constantly dependent on the amount of funding that an organization has. So I thought a little bit as well about how international human rights is a good and a difficult system to view these things, these different topics through. So one positive thing that I saw about human rights is that, well, it doesn't provide a specific system for the provision of a right. Like, it doesn't tell you how to provide the right to health care. So that allows for different, like, cultural differences to come in and allows people to do a lot with that idea of that right. But a kind of difficult part of that as well is that it may exclude aspects of the right. Like, when I think about healthcare, for me, education as well as healthcare is something that's really crucial. And so I kind of wonder whether, if people think about the right to healthcare, whether they would also think about education, and if they don't, then that's kind of excluding a portion that might be important for people to know. So I wondered about that. And then I also wondered how, like I said about technology, how you view these developing systems like technology through the lens of human rights, especially because they are so rapidly developing. So how do you understand those and come to see rights as developing and certain things like that? So those were two things that I thought a lot about when it came to human rights. So moving forward, Armaan actually has 2 chapters in the United States that they're really working to develop. They want to develop on an international base as well as they can. And so I'll probably end up doing a little bit of work for them, specifically in their development department, grant writing and things like that. And that's exciting, and I think that as well, in addition to that, the work that I did with them has really shaped the way that I view my academics, and it's really given me that experiential proponent to my academic work. And so I think that personally, I'll be able to use that as well moving forward in my Gallatin and further career. So to conclude, this project gave me a lens through which to see my academic work through. It broadened my mind on the many difficulties that maternal health advocates face when attempting to develop and create necessary infrastructure. But it also created wonderful new ideas for me about the way that unexpected sources like technology can be used to diffuse the gaps in healthcare. I'd just like to say thank you to everyone in Gallatin and all of those who organized for us fellows throughout the year. The experience has helped me to grow in so many ways, academically and personally, and shaped how I think about gender and health. So thank you.